Okay, hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything we see is magnified 30 or 40 times on the screen. We're just going to get started here having a look around. Right away we can see there's a lot of torn tissue in our face. We're going to use our shaver here just to start removing some of that. Some of that's from the biceps anchor, which we can see here. Some of this is looking like it's from the rotator cuff. So there's the biceps anchor that's torn. To the left of the shaver, the rotator cuff that's torn is right here. So as I look at this, it is nearly a complete tear. In fact, it is a complete tear there. So we'll get our suture anchor for the cuff repair and all the other instruments we need in terms of suture hooks. But you can see as we start to read the footprint where the rotator cuff should be attached, it's just not here. And now that also means we can most likely do this biceps tenodesis just using what we call a pop lock suture anchor, and we won't have to make that incision in the armpit since we're going to be here fixing the cuff. So we'll go ahead and get a hi-fi suture. Our next step is to get a spinal needle and a shuttle relay on a hi-fi suture, and we'll secure this biceps tendon. I'll need both, all three. Here, let me give you that. You're going to tap me when I tell you. Okay, so now we've got this repaired. You can see the repair right there. That looks good. As I rotate the shoulder, that all moves solidly as a unit. Biceps tenodesis is right over there. And I'm happy with the way that repair looks. Now we're going to go ahead and do one little biologic trick here. We don't have PRP or bone marrow concentrate, but we're going to make some little bone marrow vents. We're going to tap right here, all the way down. Keep going, you'll see it. More. All the way down the shoulder, perfect. And so there's one bone marrow vent. This will release some of the marrow elements so they can hopefully help in the healing process. And then we'll see if we can place one more maybe over here. We'll go ahead and tap that down right there. That's great. Okay, so we've got two vents in. I think we're done. Repair looks good. And now we're going to get you back to the recovery room. So good luck to you now. Bye-bye. Okay, so here's the back of the shoulder. Posterior capsule here looks great. No signs of any significant problems back here. The glenoid articular surface looks good. Remember, you're laying on your side, so your arm is up in the air. As we look down the front of the shoulder, that all looks pretty good down the front. And so now we're back to getting to work. First on the biceps tendon, I want to secure that. So we'll take a spinal needle, and we'll take a shuttle relay. I'll take a grasper also. And all we're trying to do right now is get right through that biceps tendon. You can see we're going right through the biceps there. We'll pass a shuttle relay through it. Take that. Okay, so here we are passing the super shuttle. And then we'll grab it here. And then before we pull out the wire, we'll back the needle out so we don't hurt the wire. Pull the needle. And then we'll pull the wire out. Now we'll go ahead and load this. Hold the camera here. We'll still two hands. One hand here. Okay. Okay, so there's our first pass through the biceps. Our second pass, we're going to get pretty close. I think that's pretty good right there. Hold this, yeah, just hold it just like that. And that's going right through. There we go. Now I just wanted to make sure. So that's definitely going through the biceps there. And so now we're going to feed that relay through one more time. Okay, so now we're going to feed a bunch of that relay through. There it is. And now here's the trick. We're going to reach behind the biceps to grab the wire this time. We'll back the needle out. And now we'll pull the wire out. The trick here, the reason why we do that is because this will give us a particular type of strong stitch around the biceps tendon and allow us to secure it. It's basically a purse string type of suture. And if you keep watching there, we'll show you that in just a minute. First, I have to load the relay outside. And then in just a minute, you'll see it come through. Okay, so now we've got that passed around. Let me see an arthroscopic scissors, please. Thank you. And so now we'll take a pair of scissors and we're going to release the biceps tendon at its anchor. Just hold those snug. We'll back out this cannula a little bit. And with this pair of scissors, we'll come in down here. You can see we're getting below the sutures. And that should be the final blow right there. There we go. So I'm going to take a shaver, keep holding, and we'll just trim up the edge of that biceps. No reason for it to not look clean. And we'll get a little bit of the superior labrum too. Now that the biceps is no longer pulling on this, this will not detach or become torn or loose. Okay, so so there's our marker stitch, that little purple suture. That allows us to find this part of the cuff very quickly once we change positions with the camera and go into the bursoscopy position, which is what we're about to do. So that looks good. There's the middle glenohumeral ligament. The subscap is just behind the blue cannula. The middle glenohumeral ligament is just at the tip of the blue cannula coming down to the right. And I think we're done inside the joint. Okay, so the top of the screen is the acromion. Deep in the screen, if I push on it, that's the clavicle. We've worked on that a little bit. There was a little spur underneath it. But more importantly, I wanted to show you the acromion here. That looks nice and flat now. That's our limited decompression, just to make more room for the cuff. That strong-looking ligament you see there, that's the coracochromial ligament. Hold the camera there. And I'm going to release that because it's pretty stout, and I don't want to leave that because it could affect your results. So we're going to put in our little cautery device here. And you'll see us just release this ligament. I got it. And that's really all we need to do to release it, as long as it's not in the way. Okay, so now we're going to go ahead and find that marker stitch for the rotator cuff. And it should be right in front of us, right down here, this purple suture. And yep, there it is. So what we're going to do is we're going to put the shaver back in. And in just a minute, we're going to pull that marker stitch. And then we're going to unroof what we call unroofing the tear. Because you can see on this side, it'd be kind of hard to find. Because the last little fibers of the cuff on the bursal side are still intact. Even though it's essentially a full thickness tear, we know that from looking from the other side. So now we'll get to that spot, which is right about here. I'm going to take away a little bit more of this synovial tissue here so we can see. And now we'll go ahead and pull that marker stitch. And then we'll just unroof the tear right here. You can see how easy it is to do because there's really nothing left anymore. And already you can see, just with that little bit, we're already down into the joint. See that hole? That complete hole right there. And so that's why we do that. Just so we can be real precise about where we open up the tear. Pause. I swear, it sounds like, you know what it sounds like? It sounds like Apocalypse Now up in here, like the soundtrack when all those freaking helicopters are flying onto the beach. Just saying. Okay, so here's the tear. I'm going to take a spinal needle in just to kind of help me plan my suture anchor placement. That looks a little bit too posterior. We'll try right about here. That's better. That's even better. We like placing the anchor, if not at the articular margin right there, or down into the joints over there, then we like to place it about 5 or 6 millimeters back right about here, just to leave a little room for healing. Now, the biceps tendon is over here. You can see the sutures going through it. You can just see the fibers of it right there. That's the biceps tendon. Okay, and so we're going to tenodece the biceps. You can see how pretty, we have pretty good access to tenodece the biceps right there as well. And so, but in the meantime, before we do that, we're actually going to, well, I take that back. We may do the biceps first just to make it easy. We'll show you some more in a minute. Okay, we've got the biceps tenodeced with an anchor, and we passed some sutures through it in addition to the one we had. And that looks good right there. So there's the biceps tenodesis right in the groove. It won't slide anymore, hopefully, once it heals. And now we're going to place a suture anchor in right about here. So we'll take a scalpel. Go ahead and pull that, please. And we'll take our guide. That goes down into the joint. And now with our guide, we don't want to be down in the joint, obviously. We want to be right about here. This is going to be an all suture anchor called a Y knot. This will be a single row, triple loaded suture anchor technique. So we're going to place it right about there. Now, hold on, you're going to have to do that. So hand her the anchor. Okay, so here's the anchor in and the sutures coming off. You can see our placement pretty close to the articular margin. I like that placement. That's going to minimize tension on the repair. I'm going to take a crochet hook. So the tools we need will be a crochet hook and a grasper, and then we'll use a straight crescent suture hook first. So we're going to reach in here from the anterior side of the joint. We're going to take that solid blue suture and take that out here. Hold the cannula down. Okay. Okay, so we've got all of our sutures passed. We've got the first one back here because we're getting ready to tie it. And then the other two, there's one coming out right here, there's one coming out right here. And those three together, once we tie them, are going to close this gap down just like that. So we'll go ahead and tie this blue one first.